The goal of this video lecture is to provide an overview of different methods of assessment, or the various kinds of tools that clinicians and researchers can use to gather information about patients and participants in research. The most basic method of assessment is the clinical interview. Clinical interview is simple. It's a conversation between a clinician or a researcher and a patient or a research participant for the purpose of gathering information about that individual's experience. So that might include their symptoms or the problems that they're experiencing, and also any related information that can help the clinician or the researcher understand the context in which the individual is experiencing those symptoms. And this really is the primary tool that clinicians and researchers use to gather information about individuals' experiences. There are a range of different kinds of clinical interviews. So one type of interview is a structured interview, and a structured interview follows a set format. So typically there are a set number of questions that are given in a specific order, and the questions have a very specific wording. So regardless of who is giving a specific interview, the interview will always be consistent. So whether you are in a different geographic location, or you have a different clinician administering it, or you're at different points in time, the structured interview is always going to follow the same format and be worded in the same way. In contrast, an unstructured interview is much more flexible. In an unstructured interview, the clinician or the researcher is seeking specific information, but they don't have a planned set of questions that they're going to follow to get the information that they need. Typically, in a clinical interview, you're going to assess a range of core information that's really important for understanding the individual's experiences. So these are going to include things like the presenting problem. So what is the individual experiencing that's leading to the assessment? What are the symptoms that they're experiencing? What are their concerns? And you also want to get information about that problem, things like when did it happen? How long has it been happening? How severe is it? How bothered is the person by it? Is it interfering with their functioning? And were there any major life events going on around the time that the problem started? In addition, it's really important to get the history of the individual to provide context for understanding the problems that they are experiencing. These will include elements like the individual's psychiatric history. Do they have any history of similar problems? Have they ever been given a diagnosis in the past? Have they ever received any treatment in the past? That can provide important context for understanding the person's current experiences. You also want to get a medical history and understand the medical context in which the person is experiencing the symptoms. This is particularly important because a lot of physical conditions can have consequences related to mental health. So for example, hypothyroidism can result in symptoms such as fatigue and difficulty concentrating that can resemble major depression. So if an individual is experiencing symptoms, it's really important to assess their physical and medical health to make sure that there are no physical contributions to what they are experiencing. Another important part of context is family history. So understanding an individual's family background, if anyone in their family has ever experienced similar problems, if anyone in their family has received a diagnosis or has received treatment. This can provide important context for helping understand people's genetic risk for particular experiences or disorders. And then another important part of history is a person's social history. So understanding things like their relationship history, so their ability to form friendships and form relationships, any romantic history, do they have a partner, their family history, what their relationships are like with their family, their occupational history, their educational history. All of this information about an individual is going to help you understand who this person is as a whole person. That'll give you context for understanding the context in which their symptoms or problems are occurring. In between these structured and unstructured interviews, we also have semi-structured interviews. So a semi-structured interview has somewhat of a set format. There may be specific questions that you ask. They may have a particular wording, but it is going to be less highly structured than a structured interview. So a semi-structured interview might ensure that a clinician asks a core set of questions to make sure that they get a particular set of information, but also allows them some flexibility to follow up on those questions with some more individualized questions so that the clinician can get all of the information that they need. Another very commonly used assessment tool are self-report measures. So self-report measures are when a patient or a participant provides information about their symptoms or experiences by responding to questions on a survey or a questionnaire. So most of you are probably familiar with self-report measures. If you've participated in any psychology department research at Davidson, you probably completed a self-report measure. Often when you go to a doctor's office, they will have you fill out some self-report measures while you're waiting to see the doctor. And there are a wide variety of kinds of self-report measures that can provide different kinds of important information to clinicians and researchers. So two of the most common kinds of self-report measures are screening questionnaires and symptom inventories. A screening questionnaire is a self-report measure that's designed to identify people who are at need of further assessment. So it won't provide sufficient information to identify whether someone meets criteria for a diagnosis. It's not going to provide comprehensive information, but it can help identify people who are experiencing problems that suggest that a further assessment would be valuable. So for example, if you were a guidance counselor in a high school, you might not be able to fully evaluate every student in your high school to see if they are experiencing depression, but you might be able to give every student in your high school a brief screening questionnaire in order to identify which students might be at risk of having depression and to do a longer assessment with those students. So screening questionnaires tend to be short and simple. In contrast, symptom inventories are designed to provide more information about an individual's experience. So it might ask about a wide range of symptoms, and it might also ask about severity of symptoms. And symptom inventories can be used for things like assessing how severe someone's symptoms are, and often in treatment, we will use them to look at change over time, so to see if someone's symptoms are improving or if they are worsening over time. I've called these self-report measures, but it's also important to note that the same kind of assessment tool can also be used with a wide variety of respondents to get information about an individual. So for example, you might ask for someone to have measures completed by someone who knows them well. If you're working with a child or an adolescent, you might ask for a parent to complete measures. You might ask for a teacher to complete measures, or you might ask someone's romantic partner or someone that they live with to complete measures. So all of these sources of information can provide valuable information and feedback about what an individual is experiencing. Another thing that you can assess to understand the context in which a person might be experiencing problems or concerns is a personality inventory. So we will talk about personality at the end of the semester, but for now we're just going to focus on how we assess elements of personality. So personality is an individual's characteristic way of thinking, feeling, and behaving. So these are enduring patterns of cognition and emotion and behavior. And personality inventories are ways of assessing and characterizing individuals' personality traits. There are two primary types of personality inventories, and they assess personality in different ways. So in a projective test, you provide an individual with an ambiguous stimulus, and you have them respond to that stimulus, and then on a basis of how they respond to it, you interpret that as being reflective of something about their personality. So one of the most common examples of a projective test is the Rorschach. So the individual is presented with an ink blot. It's an ambiguous ink blot, and you ask them to describe what they see when they look at that ink blot. And the theory behind projective tests is that based on a person's pattern of responses to these ambiguous stimuli, you'll be able to see patterns in the way that they think about things and their emotional states, and possibly even their characteristic behaviors. In contrast, actuarial inventories characterize personality on the basis of empirical research. So an actuarial inventory might be a set of self-report questions that's used to characterize different elements of personality, and the way that you interpret a person's responses on the actuarial inventory is based on previous research and previous data that uses that measure to relate to different elements of personality, rather than the kind of theoretical and subjective interpretation that you see with projective tests. So an example of an actuarial inventory is the Minnesota Multiphasic Personality Inventory. And the criteria that are used to interpret patients' responses on the MMPI were derived from a large body of research based on individuals' responses to that measure. So rather than being based on theory and coming up with scoring criteria based on theoretical ideas about what people with different personalities look like, the scoring criteria were based on empirical evidence or evidence from research. Another thing you might want information about when you are evaluating someone is their level of cognitive functioning. So what kinds of cognitive abilities do they have, and are they experiencing any problems with thought? There are a range of different kinds of cognitive assessments. So one very common cognitive assessment is called an intelligence test. So intelligence tests are designed to measure general cognitive abilities. These include things like executive functioning and planning and attention. So an intelligence test is designed to assess the kinds of cognitive abilities that are not necessarily dependent upon educational experiences. So you're not necessarily explicitly taught the content of an intelligence test in the classroom. In contrast, an achievement test measures whether an individual has achieved specific knowledge or skills. So depending on an individual's age and level of education, this might include some ability to read or conduct basic arithmetic. It might include knowledge of things that are considered kind of common knowledge. So the level of information that is assessed will vary greatly depending on the person being assessed and their age and level of education. But the difference between an intelligence test and an achievement test is that an achievement test is designed to assess whether someone has mastered skills or knowledge that they have encountered through explicit instruction. In addition to these broad cognitive assessments, we also have a range of assessment tools that can be used to evaluate specific cognitive abilities. So depending on what a person is being assessed for, there might be specific kinds of abilities that you would want to evaluate to determine if someone is experiencing problems in those areas. So these might include tests of memory to evaluate if someone is having difficulty creating memories or accessing memories. These can also include tests of what are called visuospatial abilities, so the ability to perceive images and create them. For example, if you are shown a picture, can you draw that picture? Continuous processing tasks are tasks that are used to assess attention and impulsivity, so to evaluate if someone is having difficulty sustaining attention or difficulty with impulse control. And we also have assessments that can evaluate things like executive functioning, so the ability to plan ahead, and assessments of executive functioning can also assess things like impulse control. So is an individual able to inhibit responses appropriately? So not every assessment will include all of these tests of cognitive abilities, but depending upon the reason that a person is being assessed, it may be valuable to include some of these cognitive assessments in order to provide information about that individual's experiences and important elements of their experience related to their cognitive functioning. And then finally, we might also want to get some information about a person's physiological activity, so understanding some of the biological mechanisms that might be related to their experiences. So one set of biological assessments that we can use are what are called psychophysiological measures. So these are various tools that assess the activity of the brain or the nervous system in various ways. So these include things like electroencephalograms. This is abbreviated EEG. You've probably seen these, and you may have even had one. So if you've ever seen people who have electrodes placed over their scalp and they've got lots of little wires coming out of them and they're hooked up to a computer, that was likely someone being assessed with an EEG. And an EEG measures brain activity by looking at the conduction of electrical activity on the scalp. So it is a rough estimate of brain activity, and it's primarily going to be able to capture brain activity on the cortex of the brain. It's not going to be very good for identifying activity kind of really deep inside the brain, but it can give you a general sense of patterns of activity, particularly in those outer areas. You can also evaluate what's called skin conductance. So this is measured typically using the fingers. Skin conductance is a rough measure of physiological arousal. So you can look at the degree to which someone is experiencing physiological arousal by looking at their skin conductance. And we can also look at things like people's blood pressure and their heart rate as another physiological indicator of the level of arousal that a person is experiencing. So all of these different psychophysiological measures can provide us with information about the level of activity in a person's brain or nervous system. We might also be interested in using brain imaging to assess the structure or the functioning of different regions of the brain. So if we are interested in learning about the structure of the brain, for example, if we are interested in identifying whether there might be damage to a particular region of the brain, we would use static brain imaging techniques. So these give us still snapshots or pictures of the brain that can show us brain structure. So examples of static brain imaging techniques include things like CAT scans or CT scans, and magnetic resonance imaging. So both of these are static imaging techniques that will give us a still picture of the brain. In contrast, dynamic brain imaging will show us patterns of activity in the brain over time. So if you have seen news articles or research studies where you see pictures of the brain where different parts are in different colors, and there are red parts and they say this part is lighting up, and there are blue parts and they say this part is not lighting up, your brain actually does not light up inside your skull, but that's meant to be a visual representation of increased and decreased brain activity. The technology used to measure activity varies depending on the tool that's being used. Sometimes it is based on looking at radioactive isotopes, sometimes it's based on glucose, sometimes it's looked at with magnets, sometimes it's looked at with changes in oxygenation of the blood in different regions of the brain. So there are all kinds of different tools that can be used to estimate brain activity, but the common thing that they share is that they're showing patterns of activity over time. So dynamic brain imaging techniques include things like PET scan, this is positron emission tomography scans, fMRIs, so fMRI stands for functional MRI. So unlike the typical MRI, which is a static image, the fMRI shows the function of a brain using magnets, and SPECT scans or spectroscopy. So all of these are various ways of showing patterns of brain activity over time to get information not just about the structure of the brain, but also about patterns of activity in the brain that can help us understand and provide context for what an individual is experiencing.